Today I'm going to explain about topic named local anesthesia. It's a small topic. Actually, it's not a small topic, it's a big topic. So, what is mean by local anesthesia? What is the definition of local anesthesia? Local anesthesia is defined as reversible loss of sensation of the area as well as the loss of sensation of the touch, pain, temperature, and pressure is due to the inhibition of excitation of the nerve endings or the conduction block of the peripheral nerves, which does not produce loss of consciousness. That means is a reversible loss of sensation. When we inject a local anesthetic agent to a particular area, there is no sensation the patient can feel. There is no sensation of touch, no sensation of pain, no sensation of temperature, pressure, nothing. Why it happened? Because of the inhibition of the excitation of the nerve endings or the conduction blockade of the peripheral nerves, that the patient will be in conscious, okay, that because one particular area is not anesthetized, not like general anesthesia, whole body is not anesthetized, okay. Then what is the mechanism of action? How the local anesthetics act when we inject on a particular area? First, it will inject by block of the influx of the sodium ions into the nerves. So basically the local anesthetic consists of a hydrophilic part and a lipophilic part, okay. This nerve endings membrane will be a lipophilic, and this local anesthetic, it will dissociate into ionized and non-ionized form. This non-ionized form is consists of lipophilic part. Again it will enter the nerve endings and again it will re-equilibrates into the ionized and non-ionized, okay. So like that it will happen. So it will bind to the sodium receptor and sodium receptor channels, and it will block the influx of the sodium ions, because no depolarization, no threshold potential is produced, no propagation of the action potential, and conduction blockade happens. Then we will move on to the classification of LA. Actually, three classifications are there. We will discuss about the two. That is based on the mode of administration, based on the chemistry, and based on the duration. One more there. So, based on the mode of administration, it is classified into injectable anesthetics and surface anesthetics. In injectable anesthetics, low potency, short duration. Both are low, like a small thing. Then intermediate potency, intermediate duration. Then high potency, long duration. Low potency, short duration, procaine, chloroprocaine. Intermediate potency, intermediate duration, prelocaine, lidocaine. Long duration, high potency, bupivacaine, bupivacaine, ropivacaine, and tetracaine. Surface anesthetics, soluble and insoluble. Soluble are lidocaine, tetracaine, and cocaine. Soluble, benzocaine, and oxytocin. So what is the based on the chemistry? It's again divided. So before that we'll understand about the chemistry of local anesthetic. Local anesthetics is a long chain. So one end will be the aromatic group and another end will be the amine group, and these are joined by intermediate linkage, that is amino esters and amino amides. Aromatic group will be the lipophilic part, amine group will be the hydrophilic part, okay. They are connected by esters and amides. So based on the chemistry, amino esters, amino amides, and para amino benzoic acids. Amino esters, cocaine, benzocaine, tetracaine, piperocaine. Amino amides, lidocaine, prelocaine, bupivacaine, mepivacaine. Para amino benzoic acids, procaine, chloroprocaine. What is the composition of the local anesthetics? Local anesthetic is amide or ester. Vasoconstrictor is epinephrine added, that is 1:100,000 dilution. And antioxidants is sodium metabisulfate. Preservatives is methyl paraben. Antifungal is thymol. Salt is bicarbonate. While odd salt means because bicarbonate there, no, this will cause a burning sensation. So it will be painful or itching to the patient. So bicarbonate reduces the burning sensation of the patient. Vehicle is a distilled water or Ringer's lactate solution, because concentration of the solution should be reduced. So we will add that thing. So why antioxidants will add, that is sodium metabisulfate, because these vasoconstrictors in the local anesthesia solution tend to get oxidized, okay. So to prevent its oxidation or to delay its oxidation, so we'll add antioxidants. What are the ideal properties of the local anesthetics? It should not irritate to the tissue, it should not alter the nerve tissue, and it should be stable. Solution does not perform biotransformation in the body. Duration of action is adequate to complete the process. it should not cause any systemic toxicity. That if the action duration of action is very less, we cannot proceed with any surgical procedures or impaction, extraction, nothing we can't do with it. Then we will see about the theories of the LA. What are the theories of the LA? Acetylcholine theory, calcium displacement theory, surface charge repulsion theory, membrane expansion theory, and specific receptor theory. Acetylcholine theory is nothing but is a simple theory. Then we'll explain about calcium displacement theory. Usually it is believed that calcium which is present at the sodium channel is responsible for the transport of the sodium ions through the channel. Actually when calcium ions are present in excessive amount also, they done some clinical experiment, but it did not alter its effect of the local anesthetics. Okay, then comes the surface charge repulsion theory. Surface charge repulsion theory means local anesthetics local anesthetic molecules are charged, so it will bind to the nerve, okay, nerve trunk or a nerve endings or some nerve membrane, and alter the electric potential. But that's also not the that much this thing. Then comes the membrane expansion theory. Membrane expansion the surface repulsion theory also disputed. Then comes membrane expansion theory. Membrane expansion theory proposed that the local anesthetics absorbed into the cell membrane causes expansion of the membrane, that it will expand, and this causes a narrowing of sodium channels. Specific receptor theory means it states that specific receptors are present in the opening of the sodium channels, okay, and local anesthetic diffuse across this nerve membrane and binds to specific receptors. This binding leads to alteration in the structure and functioning of the sodium channel. This prevents the influx of the sodium ions. Then we'll see about the pharmacology of the local anesthetic, that is brain, kidney, liver and skeletal muscles. This local anesthetic purviews into these kind of perfusible organs. Then comes the what are the effects, systemic effects, that is in CNS it decreases heart rate, peripheral vasodilation, hypertension, and depressive effect in the CNS, anticonvulsant effect and CNS depression. Then how we'll inject the local anesthesia is four main methods: nerve block, fluid block, local infiltration, topical anesthesia. Nerve block means a nerve trunk will be anesthetized, a large nerve, in example inferior alveolar. Then comes the field block. Field block means in terminal branches of the nerve trunk, okay, terminal branches will be anesthetized. In field block it is divided into 5 things. First is periodontal ligament injection, paraperiosteal injection, intraosseous, intraseptal and submucous. First we will see the submucosal injection. Submucosal means below the mucosa, okay, submucosa, just below the mucosa. So anesthesia, only mucous membrane will be anesthetized. Then we'll see the paraperiosteal, so it will go into the periosteum. It will penetrate into the periosteum of the underlying cortical bone. So the anesthetizing cortical bone of the maxilla. Subperiosteal injection also there. Then comes the intraosseous. Intraosseous means in between the tooth, on the both side, on either side, the injection is injected into the bone, and it cannot be done with the traditional needles, okay. Interseptal injection, interseptal bone on either side of the tooth. Then comes the periodontal ligament. Into the periodontal ligament, it's based on one single tooth, okay. Then comes the local infiltration, smaller nerve endings, terminal nerve endings. Then comes topical anesthesia, means on the surface there's topical anesthetics are applied, and surface of the skin or mucous membrane.